for joining the National Association of Community Health Workers this Friday afternoon. And we bring to you the first in this series of an opportunity to gain insights from CHW networks, associations, and coalitions across the country in their work, in their innovation, in their lessons learned as they respond to the pandemic COVID-19. I'm very excited to have with us our special guests. But before I introduce them, I always want to give a shout out to everyone who is a member of the National Association. We're so grateful for your partnership and your support of our vision. And without you, we can't do what we're called to do, which is to unify and mobilize our workforce. So thank you so much for walking with us on this journey. I want to acknowledge our board members, NACHWA board members who may also be on the call, and thank you so much for your vision and your commitment to the National Association of Community Health Workers. I would also like to introduce, and this is the first time I get to do this, our first staff member of the National Association. We have many partners and consultants and advisors, but we now have a staff member who is a senior marketing and administrative manager. Her name is Bernadine Mavhungu. And Bernadine, would you like to introduce yourself?
Hello, everybody. I'm so glad to be the newest member of NACHWA. I'm so excited to get involved in the work that is being done. Thank you, everyone, for joining us. I'll be in the Zoom fielding some questions and throwing out some prompts, so keep an eye out for those. Nice to meet you, and I hope everybody has a great day.
Thank you so much, Bernadine. So we have some special guests today. You are going to hear from each of them in a moment because I'm going to ask them to introduce themselves. That way we'll be checking everyone's microphone and making sure we have great sound. And it also kicks us off in a great way. So special guest today from Ohio would like Dolores Collins from A Vision for Change, Inc. to just say hello to everyone.
Hello, everyone, and thank you for being here, and thank you, Denise.
Fantastic. And also Brenda Lee Rodriguez from the Florida Community Health Worker Coalition.
Yes, hello, everybody, and thank you for joining us today.
And also Lisette Blondet from the Massachusetts Association of Community Health Workers. Lisette, can you hear us?
Yes, the good old, I forgot to unmute. Anyways, I'm Lisette. I am from NACHWA, and I'm delighted to be here and being part of this new initiative by the National Association. Thank you.
Thank you so much. No worries. That's why we do this test, right? So you are going to hear from each of them in greater detail. I'm going to spend a couple of moments for folks who are just joining the NACHWA community. Many of you have seen some of our introductory slides over the last couple of months. So I will go through rather quickly and then talk a little bit about why we're launching this series that will certainly carry us through to the summer, and why I think it's so essential that NACHWA move forward this conversation. I want to say once again that without our members and our sponsors, we cannot make this possible. It is impossible to list all of our members. I'm grateful to say that our membership has grown over these last couple of months. Again, I just honor your commitment to lifting up this profession across the country, and I'm grateful for sponsors who agree with this vision and who are walking beside us. The vision of the National Association has been decades in the making, and for CHWs and allies across the country who have been coming together to really understand the unique qualities, competencies, and roles, the significant impact upon inequities and health disparities, and the profound opportunity to really pursue a transformation in our health systems and in community health. I just want to thank all of you. In April 2019, the National Association was formally launched as a nonprofit, and I came on as the founding executive director in November 2019. So I've just passed my 6-month birthday. NACHWA is clear on its vision to unite CHWs nationally, across ethnicity, across sector, across our regions, so that we can mobilize and advance our support of communities in achieving health equity and social justice. We're doing this through a variety of ways, engaging allies and partners and sponsors, expanding our membership, and providing opportunity to further recognize and ignite collective action on behalf of the workforce. We are enhancing the leadership skills and opportunity of individual CHWs who are already doing excellent work, and some of that you're going to hear lifted up this afternoon. We are educating stakeholders, public and private, on the impact of CHWs, not only for downstream health service delivery, for care coordination, for recruitment, for outreach, for navigation of systems as trusted liaisons, but also working upstream, and the effectiveness and the importance of CHWs transforming our healthcare systems. And we are establishing the National Association as a voice so that we can come together and really gather and disseminate and advance sustainable strategies on issues related to the CHW workforce. The coronavirus pandemic, COVID-19, has been a significant disruptor. It has been transformative in its impact upon every aspect of our daily life. It has revealed persistent and historic inequities and disparities based on race, based on income, based on citizenship, based on literacy, based on healthcare coverage. And community health workers have for decades stood as gatekeepers, as bridge builders at the intersection of these inequities and disparities and the systems and services that can mitigate them and ultimately transform them. Community health workers are working in every sector, in housing and behavioral health. They are working on issues of economic development, on immigration. They're working on issues of opioid abuse and educational attainment. And during COVID-19, CHWs as a workforce across many sectors experienced profound disruption of service. Some of that was born out of a continued lack of awareness and understanding of the timeless models upon which CHWs, and that includes community health representatives and promotores de salud, the models upon which we stand and that we have brought from community into health and behavioral health and social service systems. And so during COVID-19, the National Association of CHWs has launched a kind of multi-channel campaign to promote the awareness of the roles that CHWs can play as first responders during this outbreak and community spread. We have partnered with the American Diabetes Association, the Centers for Disease Control, to clarify and really advance the roles of community health workers, and in particular provide CHW-specific guidance where that did not exist. We have partnered with those nationally and internationally who over time have championed or participated in or supported CHW interventions through national strategy calls and town hall meetings. And we've certainly tried to clarify our perspective that to strengthen the public health response to COVID-19, we need community health workers. It did not occur to me when I took this role in November 2019 that I would be having this conversation at the national level of such a fundamental awareness and understanding about who community health workers are. But the reality is that we are diverse across ethnicity and sector. We are diverse across regions of the United States. And while 47 states in our country have some sort of certification or training or legislation or financing or initiatives that partner with community health workers, there is still much awareness, particularly during this time, of our unique ability to develop and foster trusting relationships with vulnerable populations, to provide a culturally tailored communication and services, to support health and social services and behavioral health, that because of our lived experience, our relationships and our insight, our commitment and embedding in community, that we have unique insights that can be brought to bear to develop more effective strategies and to transform our systems. And that we are adept and skilled with training and experience to help coordinate care through complex systems, delivered through many mediums in terms of in-person and phone and telehealth and social media and online platforms. And CHWs have really risen to the occasion during this time. CHWs are a workforce across our country that is pivotal and critical to enhance public health and the safety net capacity that is desperately needed right now. As states and localities are trying to facilitate greater access and availability of shelters and food pantries, giving people access to healthcare coverage when they've lost their jobs, making sure that people continue to access preventive services, as well as the services specific to COVID-19, testing and contact tracing and care coordination. CHWs are here to provide social screening and social support. We are here to help monitor systems and help people to cope and adapt to social isolation. We are here to provide vital self-management support to patients who are living with and attempting to continue to manage their chronic conditions. But it is important that as a workforce, we are also protected during this time. It is important that we have the right guidance and training and access to personal protective equipment. It is important that as a profession, that we are also acknowledged for the underlying conditions we may have. It is important that our self-care and our well-being is maintained as frontline workers across our country are having a greater impact in terms of infection or the mental health impact of treating thousands upon thousands of people with COVID-19. It is important that CHWs earn a living wage, that they have continuous access to healthcare coverage and other benefits. It is important that our profession have the right guidance in terms of workflow protocols and training, and that our supervision and our caseloads are realistic with the time that it takes to do the work, the time that it takes to provide a high quality cultural competent service to our communities. Briefly, NACHWA has been lifting up 3 strategies for all public and private institutions to really amplify CHWs during this time. Classifying CHWs as essential critical infrastructure workers and paying them to respond to COVID-19 is essential. And while some states acknowledge the profession as such, many states did not adopt this language. And as a result, many CHWs were laid off, they lost their jobs, they were furloughed, they were reassigned, they were taken out of community, they were prevented from conducting their service. But as essential critical infrastructure workers with the right guidance and protocols and protection, we are still effective during this time and are essential right now to strengthen public health capacity. NACHWA is encouraging public and private institutions, as you develop initiatives to stand up and mobilize testing and contact tracing and care coordination for those who have been impacted by COVID-19 in terms of infection or illness, but also for the tens of millions of people who have lost their jobs and now need to access the variety of services for which CHWs are expert. It is important that public and private institutions see our CHW networks and associations and coalitions as anchor institutions in our communities. Our organizations have expertise to identify and plan for workforce scale-up. We have the ability to communicate and create a feedback loop between the workforce and health systems. We have the ability to train, to supervise, and to co-design these initiatives as they are being developed so that we make sure we drive equity. We make sure we reach vulnerable populations. And as we shift to recovery and rebuild and the reopening of our communities, our CHW networks and associations have had increased capacity through financial investment, through strengthening our partnerships, through a long-term sustainable vision so that we can really improve and innovate during this time. It is important for NACHWA that we offer our CHW networks and associations as leaders to be present, to partner with, to design, to monitor, to improve upon these contact tracing and other initiatives and community recovery efforts and long-term for health system transformation and rebuild. So as we begin to pivot to today's conversation, and it will be brief PowerPoints from each of our three speakers, but we've left time today for your questions, which you can throw into the chat box and which we can take verbally when the presentations have completed. We're really lifting up the excellent work, the innovation, the adaptation, the expertise of our CHW networks, and the way that they have responded to unique aspects, essential aspects of COVID-19, how it is impacting the CHW workforce and how it is impacting our communities. And so I'm so excited to offer to you our three speakers today. We are going to hear a little bit about how CHWs are, how our CHW networks rather, are concerned about organizing and providing services and knowledge to help CHWs manage their own self-care needs as they continue to serve individuals, clients, and communities. We're going to hear how CHW associations and coalitions are developing curriculum and training and recruitment for workforce development specific to COVID-19, providing the necessary expertise to be able to safely deliver services and to understand this virus. And we are going to hear about a CHW association that has been at the forefront of specific efforts around contact tracing and care coordination efforts. And so all of this work continues to evolve. We are by no means looking back as if all the lessons have been learned, but there are early learnings that we want to offer our country and our partners. So without further ado, I'd love for Dolores, lovingly called Ms. D, to once again introduce yourself. And Dolores, I will advance your slides, and I look forward to hearing your presentation representing the great state of Ohio.
Thank you, Denise, for that wonderful opening. Just thank you so much. As Denise said, yes, I'm known here in Cleveland, throughout Cleveland, as Miss D. I am the founder and the director of A Vision of Change. We provide intervention, prevention, and academic services to families dealing with health disparities, and we've been doing that since 1993. I'm also a community health ambassador for one of our neighborhoods, which is Glenville. I've been a master trainer through Stanford University's chronic disease self-management workshops, their programs, any of their programs basically that deals with self-management. I also completed Cleveland State University's Community Health Workers Program, and I'm very proud to say that I am a certified community health worker through the Ohio Board of Nursing. I'm also the ambassador for the state of Ohio of NACHWA, and I'm the founder of the newly formed Greater Cleveland Community Health Workers Association. Next slide. Okay, before I get into this slide, I would like to say that self-care is a value and a belief, as Denise said earlier, of NACHWA. And I had the wonderful opportunity to see this and feel this firsthand at the launch of NACHWA. And that feeling around self-care is something that I wanted to bring back here to Cleveland, to let our CHWs know here that our National Association of Community Health Workers do care about our well-being. So I've had the pleasure of working for the last 4 years with Dr. Joan Tolman, who is the Associate Dean of Research and Collaborative Partnerships of Cleveland State University's School of Nursing. And during that time, I've seen and worked with 4 cohorts. We're on our 5th cohort currently. And I've watched students grieve for their loved ones. We've also had classmates who passed away suddenly. I've heard how some of our CHWs are mistreated on the jobs and in other environments. And also how we suffer, because a lot of us have chronic conditions and things of that nature ourselves. So we tend to share how we're self-managing our diseases. Some of the diseases or chronic conditions that we have it goes from diabetes to MS to arthritis. And then we also, deal with different types of stress and things too. So something that I really wanted to happen in our weekly classroom sessions was to create a space where our CHWs could exhale from all of the work and the hustle and the bustle of the week. So I began to do different affirmations and just different like little meditations with our cohorts. And this was something that we loved. So out of that came Cleveland's own CHW Self-Care Committee. And it was formed to support our fellow CHWs in this special time of need. Our committee is providing strategies and tips to help manage good self-care. Self-care could be any activity that we do intentionally in order to take care of our mental, our spiritual, emotional, and our physical health. We're also providing a source of information for CHWs to develop a good relationship with oneself and others. Okay, some of our committee members are actually from cohort 5, and I would like to mention them if that's okay. We have Alfernice, Cher, Lisa, Ursula, Vanessa, and also one of our associate partners from Panache 5 Adventures, Siobhan. So in doing these different, we began to meet monthly, and we actually launched our first edition that we pushed out to so many CHWs. And I want to thank those CHWs who also pushed it out to their networks. And of course, with COVID coming upon us unexpectedly, we did come upon some challenges. And some of those challenges was we were no longer able to meet in person and have those personal little social events. And another challenge was our member participation. So we could no longer be in the same space together. So we had to get innovative, right? And of course, everybody switched over to the virtual platforms, and we had to do the same thing, right? So we began to do our weekly CHW social hour. And this is a platform where we meet weekly in the evenings on Wednesdays. And the CHWs had the opportunity to come in and to share just how their day has or week has gone, and just give them that place where they can really just exhale, you know, just to get it out. So we did that, and we also do our monthly meetings now through our Zoom. So something else as far as what we got when we got innovative, we also set up, like I said, the meetings and things like that. So we did a special event where we got together and we did little line dances and helped do, you know, we all had our nice little beverages. It could have been like a smoothie or whatever, but we would get together and create and do those type of things. And then back to the slide, the next innovation that we did also was our share box. Our Dropbox that we created was a platform or a place where the CHWs could also drop that different information that we needed for our weekly newsletter. So before I close, I would like to say that we are grateful. We are very grateful to all CHWs for your care, the time, and your dedication to help yourself, your families, and our diverse community members improve and maintain their health and well-being. Individually, y'all, individually, we may not have all the answers, but together, the world is able to fight and persevere despite COVID-19. So before I turn it over to you, Denise, I do want to just share this last thing. It's an affirmation that was posted in our first newsletter. The struggles you're in today is developing the strength you need for tomorrow. So don't give up. Thank you.
Wow, Dee, thank you so very much. Thank you. I haven't checked the chat, but I know that folks are posting and asking questions, and I'm grateful that Bernadine is managing that. We're gonna come back so that people have a chance to ask you about what you were learning, how you're facilitating these self-care meetings, you know, what you're hearing from people. So just stay with us, hang back, and thank you again for your commitment to the workforce, creating a space for healing and a space for hurting people, right? So that we can heal. Thank you for going head on into it and finding it so essential. Thank you.
You're welcome.
Okay, I'd like to now ask Brenda Lee Rodriguez to unmute and take a few moments to share with us what's happening about 1,000 miles from where I am right now in Florida. Brenda Lee, thank you so much for being with us and for sharing with us what the Florida CHW Coalition is working on.
Thank you, Denise, for the invitation and this opportunity for all of us to network. And I applaud the decision to have the self-care session first. It's always part of the conversation about CHWs and what they need to learn, what they need to do for others. But I think that this setup really reflects an important pillar that we want to influence around us and the workplace of the community health workers. So I applaud that decision. Well, a little bit about me and the group. I'm Brenda Lee Rodriguez, past co-president and current board of directors member of the Florida Community Health Worker Coalition. And I work at University of Miami on several roles as related to research support. And our organization, we were very clear, making a statement about calling it a coalition because we wanted for it to have a place for all the allies, everybody alongside with community health workers and promoters from the beginning. And in terms of our story, we started as a task force, a 50-member task force back in 2010 with a CDC-sponsored award to as a policy and systems change category to the Florida Department of Health. And from those original calls and initial annual meetings, right there on the first year, 2011, of our grouping together, we did a logo, and we wanted to really make it a coalition. We looked at different models at the time because we really thought that professionalism was important in the state of Florida for community health workers. And we all thought that credentialing, it was an important component for our workforce development story. We were talking to nurses, we were talking to many type of stakeholders, and credentialing was an important conversation we were having. And in looking at all those models, we decided to go to a third party, the Florida Certification Board. So that is different from many other of the groups that before then and after has formed credentialing programs. So every activity that we aim to do in terms of education relates to certification in one way or another, to kind of support that original effort that was launched to the public on January 2015. And since then, we have been able to certify over 600, and the numbers fluctuate as people renew their credential or not, based on their current status in their careers. For more information, you see the links on Facebook and our webpage that is going renovation and updates as we speak. Next slide. And my role here today is to share with you our education effort on COVID-19. And since February, all of us, we were kind of looking at how this COVID-19 was emerging as a public health problem. Immediately, I was taking a look at what other states were doing in terms of education of community health workers with this new disease. And I looked at what Texas was doing with the Dia de la Mujer Latina, and they did an education session, and also Project ECHO in New Mexico. And we said we need to do something for our Florida community health workers. And it took 3 weeks of back and forth with the Department of Health, but we finally got to have a co-led education session. Myself as a recognized education provider for the state, so people, attendees will receive that certification hours, but also the scientific side and the public health expertise from a member of the Florida Department of Health as an example of that partnership. And we finally got our date, April 24th. The content was, had to go through several loops of approvals and clearances, because anything working with the Department of Health, especially at those times where all the information was evolving on the last minute and deciding what are the priorities and what is relevant, and also make it in a way that, number one, affordable, accessible, and very relevant to the needs of community health workers, because a lot of information was coming out, very high scientific, and with sometimes conflicting even guidelines and information. So we had to spend a lot of time dispelling the myths, actually, based on the information that we had at the time. And that information has evolved. So if you look at it now, some of that information is kind of version 1, and now we are on version 2. And the organization was simple. The content was very specific to community health workers, that's linked to our competencies that is linked to the certification objectives. And we wanted to make it accessible and doable for many, so we kept it for 1 hour, free of charge, of course. And the bulk of the time was on COVID-19 with the representative from the Department of Health. And you see the outline there on what we covered. We really wanted to link our CHWs with credible information from the CDC, the Florida Department of Health, and WHO, and giving them resources that were at the time put together, available in languages other than English, along with English. In our case in Florida, that is Spanish and Haitian Creole. And of course, kind of a formula to help them navigate all the information that they might be getting from friends, family members, and social media, so they can discern what is true, discern and dispelling the myths that they may encounter, and emphasizing correct information. And we had a very good turnout. We had a lot of registrations, and people attended mostly via Zoom as intended, but some individuals stayed over the duration of the call on the phone, for a total of those 324 unique participants that stayed for the whole hour. And more than half of the Zoom attendees completed a post-webinar form. And in that way, we are collecting data that we're looking at it now in terms of level of knowledge and attitudes and so forth. And by responding to that post-webinar form, we send the education certificate for their credential. And just quick numbers from the total attendees, there was a big chunk of community health workers that were already certified. And from those that attended, we wanted to provide that information. We have the links, it's already on YouTube, available in the University of Miami CTSI website. They really took care of all the logistics with the actually the registration, the putting it together, the technical aspect of it, managing the chat box. I know it's a lot of work. So for those organizations that are listening, and you really need to put a good team together and maybe partner with others, because for your own efforts, it's better to split the pie and have everybody contribute to the best of their abilities. Next slide. And yes, we're sharing, and hopefully today at the end of the session, we are going to share some of those learning points and continue to grow. As we know, the world has changed. There's no going back. We will develop a new normal, and hopefully not only looking on beyond healthcare with all these innovations, reconfiguration of the stakeholders. We have seen how new partnerships have emerged and new ways of doing things are emerging. The challenges, of course, is the coming together physically, and that is a big part of what community health workers do, not only for their service, but also for their learning. And it's not only just a webinar, but then talking about it, raising questions and sharing their learnings. So documenting is important with this quick pace and the quick turnaround. We need to continue with the advocacy work with the public health workers. So I applaud this organization for doing that and keeping it loud. And in terms of my personal take and pushing towards the CHW and expansion of the role, to continue with the increased role of CHWs in research, because we are now needing to do data collection and having consent and do tracking and data management, and later on interpretation of that data and dissemination of results. So that's an important role, expanded role of community health workers that can be maximized in this new era. Thank you.
Thank you so much, Brenda Lee. You also lifted up so many important components. I loved hearing about the partnership and the development of this partnership led by the coalition to dispel the myths that were critical not only in the early months, but continue to be critical because we're learning about this virus, constantly learning. I loved the option to have Zoom and a phone call. And I think that just represents the way in which you tailor and meet the needs of CHWs wherever they are and however they can gain access and make sure that you're expanding that access. I'm excited. I haven't checked the chat, but I'm excited to hear more about the way in which this curriculum, maps back to the competencies and roles of CHWs and just how you're seeing CHWs reflect upon the knowledge that they've gained now about this virus. And I couldn't agree more about the challenge around documentation is so often, and I know as a research leader as well in the CHW space, it's less often that CHWs are part of the design and development of research projects and really articulating our effectiveness through reports and other means through the structure of research. But we are learning so much and we will not go back. Some of our systems will be transformed for better or worse, but they will be transformed. So I think the documentation is critical. This is why we left an hour and a half for this session so that you could hear from many different perspectives of how our CHW networks and associations, critical anchor institutions for research, for the development of the workforce, for advocacy, for the health and well-being of the workforce, to develop meaningful and sustainable partnerships. This is why we're having this session so that we can lift up their great work. And now I just want to ask Lisette Blondet to unmute herself and spend a few moments with us talking about the work happening at the Massachusetts Association of Community Health Workers. Welcome, Lisette.
Thank you, thank you. Because I want to have time to show you guys, to share with you one of the fabulous videos that our community health workers are developing for self-care. I'm going to go through these slides as quickly as I can, but encourage you to please check us out at machua.org to find all the information about Machua, or email me, call me, whatever. We're here to share our experiences. But very quickly, we were founded in 2000. So we are 20 years old. Right now, we have 967 active members, and you will hear what I mean by active. We have a 13-member advisory board that's comprised both of community health workers and allies. And since 2017, we've been fiscally sponsored by Health Resources in Action. The way we organize ourselves is through regional chapters. Bernardine collapsed some of the slides, so these regional chapters we call machuitas, little machuas for those who speak Spanish, and they are coordinated by a senior community health worker. In fact, one of them, Jamie Berberena, is on the call. I can see her name on the list. Hello, Jamie. And what these regional networks do is that they keep an ear to the ground about what's happening for community health workers in a particular region of the state. We have 6 regions. Right now we have 2 chapters, launching a 3rd chapter. We provide professional development forums quarterly, and hopefully when the CEU's process becomes formalized by the Board of Certification, these professional development forums will be able to offer CEUs. We also have close relationships with many of the employers or key leaders in a particular region, leaders that could help or partner with us to improve the quality of work or the working conditions for CHWs. They are also a vehicle to promulgate information back and forth. So we bring information out, but also inform the state and now the National Association about what's happening here. Next slide, please. Thanks. So basically we have two reasons to exist. One is to advocate for the workforce, and that advocacy takes place with health system, payers, funders, legislators. We have two very specific goals for this year. One is to implement the wages that we propose. We have created this wages brief that talks about not only wages for a community health worker, but different wages based on experience. As we all know, community health workers are usually perceived as entry-level work, and the fact of the matter is that there are folks doing this who have been at the field for 20 years or more, and that experience needs to be acknowledged just like it is in any other profession. And then the respectful integration of community health workers into health and social service teams, so that the systems of care, be human services or health services, really understand the worth of community health workers and integrate them based on what we do best. Next slide, please. Then the other big thing that we do is the support of the workforce. We are trying more and more, and hopefully we can do a webinar on other peer-led workforces that are beginning to work with more closely. But for 2020, we want to increase the number of community health workers who are taking advantage of certification, mainly because we see certification also as an opportunity to increase wages. It's voluntary in Massachusetts, but community health workers who are certified should get pay increases accordingly. We want to provide CEUs for community health workers to maintain certification. And we want to make sure that regardless of where you are in the state, you can take any training that is relevant to community health workers, including certification, so that you don't have to come to Boston to be trained if you live 3 hours away, but your region will have the appropriate training and resources. Next slide, please. So, and I think that this is kind of the reason that Denise wanted us to share our experience. We are learning, and as I was preparing this slide, I realized that this only happened 3 weeks ago, this little mini case study that I'm going to tell you about. Things are moving so very fast. So I think that what we are learning as a workforce in Massachusetts, I've summarized into 2 bullets. One is how much the pandemic has shed light about the importance of statewide associations of community health workers. And I will illustrate this by telling you this story of what happened, how we inserted community health workers into the tracing efforts that were taking place in Massachusetts. The state, only about 5 weeks ago, launched this initiative to do contact tracing and care coordination of people who were affected by COVID-19. Community health workers were nowhere on the conversation, and the the programs that got contracts from the state to do the contact tracing and the care coordination were not necessarily tied to the community health worker world. We could see the job descriptions, and in fact, the job description for the care coordinator called for encourage social workers to apply. Nowhere in the job description were community health workers mentioned. So the challenge for MATRA became, how can we insert community health workers in the conversations? So we were able to attend a meeting, a webinar where we knew Partners in Health was going to be in, and kept writing in the chat box, you know, you need to hire community health workers. Community health workers are the ideal care coordinators. Community health workers know the community. And the next day, and someone at the end of a meeting read those statements out loud, and you know, the person from Partners in Health agreed, but there was no motion. So we then emailed them and asked, can we talk? They very kindly accepted. And except, you know, we did what we could, but it was a little bit late because the job postings had already gone out. 18,000 people had already applied for 1,000 positions. So our case was, look, we want to work with you because we want community health workers to fill these positions because they are qualified like no one else in the healthcare system to address the needs of the communities and cities in Massachusetts that have been disproportionately hit by this pandemic. I'm sure that this is true for the rest of the country, right? I mean, and it so happens that a lot of community health workers also live in these neighborhoods that are being hit disproportionately. So our point to Partners in Health when we had this conversation was, work with MATRA, don't work with individual community health workers. Don't try to recruit community health workers, you know, on your own. I mean, we have a captive audience, we can help you. But this was moving really, really quickly. So we offered them that we could outreach to our members, 950 some, I just mentioned. And they agreed that when MATRA made a referral, those applicants will go to the top of the list automatically, which was a great thing. Again, 18,000 people had applied for only 1,000 jobs. So we did exactly that. We not only did the outreach via email and also our Facebook page and website, but with the survey, with the job application and information, we attach a survey that community health workers would fill out and tell us, you know, what city do you live in, how many hours are you interested in working, yeah, basic stuff. I mean, and there were 3 positions, which position are you interested in? And we will send those names, those Excel sheets to Partners in Health at the end of the day. We did this for 3 days, something that is 107 community health workers actually applied and completed the survey in 3 days. And after that, we become kind of, we troubleshoot with community health workers who are applying, had applied. Someone called us about, you know, they have been, there are many glitches within the contact tracing and care coordination, as we can all imagine. It's a new initiative. But so the professional association is here for the people that we referred to help them make sure that they are hired and work successfully in this context. By the way, it's unfortunate that we did not, I mean, and this is not, the blame is not on Partners or anyone, but it would have been great if the professional association had been included early on. I mean, when the state was thinking about what contact tracing and care coordination should look like, and also subsidize some of the work that MATRA did. We did this because we believe in our workforce, and we know that no one else would be better at doing care coordination than community health workers. So that story will continue, and I will be happy to provide updates later on. But the second point that I wanted to make is that at the end of April, we started hearing through our networks that, you know, people were really terrified about losing their jobs. People were really mourning the face-to-face connections with their clients, with their peers. You know, when you're a member of a profession that it's all about connecting with people, to become a virtual CHW, all of a sudden, it's painful, it's hard, it's stressful. So we launched what we call the COVID-19 information campaign for CHWs through our website, Facebook, and direct mailing. And we organize information in 3 buckets, which is amazing. Brenda Lee and Ms. D, how similar you know, our efforts are, and how much we are all in alignment. So I think Brenda Lee talked about some of the information that at the beginning, anyways, at the beginning is the end of, or middle of April, people were, the information that we got was mostly the scientific information was totally irrelevant for the workforce. It was really geared towards doctors and other primary care providers. I see that Arelis Barbosa also joined, one of the coordinators of MACHWA in Western Mass. So we decided to curate the information that we posted so that we could make sure that it was relevant to CHWs. Then we wanted to provide resources for professional development so that community health workers could continue to work on their, you know, own professional growth. And then tools for self-care. Ms. D, we are exactly there. So as part of the tools for self-care, next slide, please. And I know we don't have much time, but is there one more slide? Oops, I guess not.
I can show your video now, Lisette, if you want to just describe it.
Yes, well, so anyways, we got together, Arelis, Jamie, how can we support our peers during these difficult times? And came up with the idea of inviting CHWs in Massachusetts to share with other CHWs in Massachusetts how they are coping with the stresses of doing work from home as a CHW. So we provided instructions. Please visit our Facebook site. And this is the first one that we launched that was done by Jamie. So thank you.
There's not, sorry.
Huh? No sound.
Oh, can you not hear that? Here, let me make sure that you can hear the sound.
Jamie, by the way, is the regional coordinator for the Southeast.
Okay, great.
Okay.
Can everybody hear that?
No.
No, oh no. All right, let me just double check that.
Well, that's unfortunate.
So Bernadine, let's go ahead and make sure that we put the link in the chat.
Yes.
So that people are able to listen to that and also get connected to MACHWA through the Facebook page.
And the other two that are wonderful. So there are, right now there are 3, we just launched this last Friday. So there are 3 already uploaded. And so I'm sure you will all like it.
Yes, wonderful. And at the end of this, within the next day or 2, I will also be sending out these slides and a recording of the webinar, and I will include the link to MACHWA's self-care project as well.
Thank you so much, Bernadine.
Yeah.
So we are at the hour mark, and Lisette has shared a lot. You know, she said it was a short case example. It was filled with valuable information because, as I have been saying to her, and she and I are developing our friendship via these remote platforms, phone calls, and Zoom. Her work, her advocacy in these specific contact tracing efforts and these initiative designs are leading for the profession. There are not many contact tracing initiatives that are fully involving CHWs, and her learning about job descriptions, about recruitment, about the roles and how to develop partnerships and educate partners about this workforce, and our ability to stand up quickly, to be ready to respond to this urgent need for not only contact tracers, but for the care coordination services, because we're leveraging our skill, our expertise, our qualities, honed over, for some of us, many decades, I think is really essential. And so obviously the slides will be shared, but take more time to really carefully consider the pieces that she rolled out for us and how she operationalized this strategy to advocate for the workforce and to better integrate not just the workforce for individual CHWs so that they could gain access to these jobs, but what it means for the community to bring in these bridge builders and to bring in, when you bring in CHWs, you're bringing in the voices of the community. You're bringing in the needs of the community. So I'm excited. I want to start opening it up for questions now. So I'm seeing excellent resources. This is great. Thank you for sharing. Folks are kind of going through that. I'm hearing a couple of things, and I want to just talk about the role of CHWs now in COVID. Not everyone is involved in contact tracing. Not everyone has had the sort of formal training that Brenda Lee has offered. And not everyone has access to this sort of robust self-care coordination. So there are distinctions here, and I'm sure people on the call are thinking, well, how does that compare in my state, in my region, in my city, in my locality? I would love for each of you, Brenda Lee, I'm gonna ask you now that folks have had a chance to go through your training, and I'm gonna ask you to kind of weave in some of the self-care, and I'm gonna weave in some of what all of you have said. As CHWs are dispelling myths, as they are taking the information from your training and bringing it out into community, what have you had a chance to hear back from them? In other words, are they asking for subsequent training? Is the pace of the virus and our learning happening so fast that now you think we need ongoing communication and coordination of training? And are they bringing to you the needs of the community members? And will that, or is that impacting your approach to training going forward?
Yes, hi. Well, a lot has happened after April the 24th. We had a lot of questions right then and there. Some of those questions we were able to answer right away, and others we forwarded to the Department of Health, and they are going through the clearance process so we can send those like a synopsis. But after that, also a lot of feedback we have received and interest from other departments and sections and programs within the Department of Health, asking the coalition, asking us what can they do to incorporate the work of CHWs. It was like an aha moment. Mm-hmm. And especially triggered by a lot of funding that is becoming available. As you know, that changes the tone of the conversations. Also, area health education centers, our AHECs, have approached us, the coalition, also to ask for, okay, now we need more specific training. How about how to better use and correctly use the personal protective equipment? That's a hot topic.
Yes.
Another hot topic that we have been approached not only by the AHEX, but for academic centers and local governments have been contact tracing. And it has been good to see many trainings already being popped up through Coursera, through other organizations that are putting that together for contact tracing. I know of several examples within Florida that have included community health workers, but also medical students. So they are kind of different ways to go about the contract tracing workforce, and it will be very interesting to see the differences between the training needs of these two groups, just as an example, and follow through with implementation of those. And lastly, the mental health component about the stressors, about coping with the COVID-19 pandemic and the impact not only on them, but how are they assisting their communities, where to go for testing. Those are emergent needs that have come up from all different angles, and we're trying to address them as with the scope of work and meetings and calls to see what, how can we better address those emergent needs at the moment.
I appreciate that, Brenda Lee. It just, again, it heightens so many aspects of why we're doing this webinar series, so that partners, public and private, as you mentioned, the kind of light came on, seeing the coalition as a resource for workforce planning, for workforce development. Really, you were meeting the needs of your members and CHWs, in Florida, but it has become an opportunity for people to have greater recognition for the workforce generally. And I love the way that you are talking about the next level trainings and what else people are asking for. The guidance around PPE is critical, and it is still very difficult to find information that is made for and responsive to the roles of community health workers. As Lisette mentioned, all of this work around contact tracing and community recovery cannot be done remotely. And so it's really important that we recognize this critical infrastructure workforce and protect them accordingly. Ms. D, I'm gonna ask you to unmute and just talk about how your self-care group is taking in the unique and profound disruption of COVID. Your CHWs could be working across sector. Some of them may be doing contact tracing. Some of them may be just adapting the current services that they were offering to community members. Are you seeing more CHWs coming because there's increased self-care needs? Are you recognizing how COVID is impacting the desire for CHWs to want to come together and support one another? And how does that relate to training? In other words, does self-care become something that becomes part of certifications and formal trainings and is made available so that we really move upstream and talk about building skills for resiliency?
Yes, Denise, thank you for that question. We do, and we are seeing the increased need because we do have CHWs who work in various areas. And because of that, as you're saying, that the need and things for our CHW is getting even greater. We've been contacted by our Cuyahoga County Board of Health, and just the city, they're contacting us as well. So my thing is to really bring forth our CHWs, making sure that they are taking care of themselves first, and in order to be able to serve our community at the capacity as far as what's needed, because we know there's so much isolation going on, depression, different types of stress and things of that nature. And we ourselves can fall into those same situations. So it's very important for us to take care of our own selves. And yes, this can become a part of the curriculum, self-care. You got the yoga and the Reikis, you know, the Qigongs, those different types of things can be incorporated. And that is what we're bringing into our classrooms, is that particular type of self-care. So our goal is to expand it to all as many CHWs as possible. I'm going to reach out to Lisette, any of our other associations who are doing or have toolkits around self-care. We want to bring those to the forefront and make sure that all of our CHWs are receiving this self-care, because it is very much needed. Denise, I need it myself. And I know if I'm in need of it because of this change that has came about with COVID, I'm not used to being in my home environment like this on a regular basis. I like to go. I be on the go in the meetings and different things like that. So the voice of CHWs and the CHWs period is ringing on so many ears here. We want to also just not to let them to forget to really just take that time to care about yourself. So we're working on in many different areas around community health workers, but self-care, definitely we want to make sure that it becomes a part of the community or our curriculums and just different things like that.
Yeah, I thank you for lifting that up. You know, it's with a heavy heart. I thank you for the information, but I do acknowledge, you know, again, the toll that it is taking. You know, you talked about how CHWs need to be understood for being people, not tools, you know, to solve problems. We are people from the community. We are people who experience everyday racial stress. We are people, you know, who work in a precarious workforce. You know, until we have sustainable financing, we are moving from grant program to grant program. We are working in communities that can have high rates of violence, that can have high rates of environmental pollution, that can have high rates of stressor, lack of, you know, of food security or nutritious food access. So there are lots of issues in a larger environment within which CHWs are working. Finding people that, you know, the common definition of CHWs as these trusted liaisons, these bridge builders. We are building bridges across silos. We're building bridges because others cannot traverse them. There are crevices and cracks and huge gaps between equity and services, you know, between access and cultural competency, between, you know, respect and dignity for all human beings, and well-being and health. And so CHWs are also impacted by the health and the barriers of their community members. They carry that pain. They carry those challenges with them. And so we just honor the work of all CHWs. So want to talk to Lisette, and then I'm going to come back to all three of you as we start to round out, and I'm going to continue to check the chat box. Lisette, you know, you have 900 or so, you talked about kind of active members, and about 10% of those folks in 3 days responded to these existing job descriptions. This wasn't something that you know, that CHWs had a hand in the design of, but they were responding to the needs of the system to scale up this public health workforce. You know, talk to us about the understanding, and you can speak specific to Massachusetts or just as we all understand these contact tracing initiatives better. What do you think about the understanding of these contact tracing efforts and the roles of CHWs or who CHWs are? In other words, to what extent do you think CHWs are going to be able to fully manifest our roles, our qualities, and our skills? And do you think that may have an impact on CHW self-care needs?
Humongous question. But I just want to put in a plea for the National Association. One of the things that this pandemic and the contact tracing and all the work that we did in 3 days was only possible because we have an association, because places like the Massachusetts Department of Public Health has chosen to invest in creating an infrastructure for community health workers. If MACHWA were not here, that would not have happened. If MACHWA were not here, we would not be able to help, for example, with this outreach for the certification process. But when it comes to contact tracing, I think that the policy needs to be at the national level. To me, the fact that the job description for a coordinator or whatever, a care coordinator, calls for a social worker and doesn't mention a community health worker, it's awful. We've experienced this again and again and again. It's time for that to stop. This is one of those situations where you have the same communities where community health workers live and work being hit disproportionately by this pandemic. And yet you don't think about these folks that know not only the community, but every possible resource within that community as leads or the best possible workforce to intervene. Actually, I was perplexed and continue to be. So I think that there is an important role for the National Association to do this kind of advocacy, not so much with a subcontractor, in this case, that was Partners in Health in Massachusetts, but at the state level, where these things are launched, community health workers have to be at the center and explicitly mentioned as key providers in these efforts. There is no one better than a community health worker, actually, to do this work.
Thank you very much, Lisette. Bernadine, you see some questions in the chat that we want to lift up in the remaining minutes?
Yes, I do. We have a question from Rick, and this is directed towards Brenda Lee. He says, have the people who have contacted the Florida CHW Coalition expressed concerns about their own health being affected by COVID-19 at work?
Hi. With the conversations that I have had, and in particular with one project in which CHWs were integrated into contact tracing as a pilot in the Northeast area, there were some concerns. And actually one case of a CHW was, at the time, was reported that it was associated with that work. So the remedial activities included revision of the training protocols, revision of the PPE training, and follow up with, of course, the health of that particular individual. And there is a need to share examples like that in the follow-ups, particularly because we're learning as we are doing this, right? And although one case is not reflective of the majority of the work and what's happening in other places, but it's an opportunity for us to see and take it as a learning moment. So yes, those concerns have been raised, specific cases have happened already, and we are sharing the information as much as we can.
Thank you, Brenda Lee. And one more question. This could be to all three of you and Denise. This is from Stephanie. For those who don't have an association or a network, What advice would longstanding association networks give to those who are looking to start one?
Oh, wow. Well, it starts, I don't know if you said Stephanie, I don't know if she's a community health worker, so I'm not sure from what perspective she's asking the question. You know, it starts with that organizing and then mobilizing locally with other CHWs. You know, developing an association, a coalition, a network is valuable if it's valuable to the profession. And it's not something that can be done alone. It takes partnership with allies, as folks have spoken about and shared throughout this call. But you know, NACHWA, we want to make sure that CHWs are leading these conversations, these decisions, these exploration opportunities, and that it is driven to advance and support and promote the workforce. Ladies, what would be your thoughts?
I can, this is Brenda Lee. I can just quickly share. I saw from the chat room that she's from, the person that is asking the question, I think is from Texas. And I've been working with groups of community health workers in Texas for 5 years now. And I have seen a lot of, because Texas is a big state and there are some regional differences in terms of demographics and players and stakeholders and connections with political advocacy efforts. So I've seen different groups, regional groups and interest groups. I haven't seen, of course, a statewide unified voice because there are different segments that have different priorities and so forth. So for other states that are looking at this, I always let them know to take a look at what other states, how they have approached it, because there's no single formula to go about this. We have seen examples from New York, from Texas, not only certification, but in the nature of association or coalition, or because the names are important. They reflect the spirit, the mission of that particular group and stance that they want to take. So it's important to look at what the progress that have been done in the last 10 years and seeing different models and compare it to what your local needs are.
Dolores, would you like to add to that?
Yes, I would. I can speak from experience because it was my passion and a life situation that caused me to form my nonprofit organization in '93, and I got a lot of lessons learned. So it's talking to people like myself and other people who have started organizations. I now have a development consultant. And then Denise, I was going to also ask, do we have a ambassador in the state of Texas? Maybe we can, she could also
Yes, we
connect
do.
with ambassador.
I'm going to chat Stephanie and let her know to reach out to me.
Yeah, and then do your research. Do your research. Like as Denise said, that collaboration. You want to definitely see and reach out to other CHWs who has the same passion that you have, and do your research around nonprofit organizations and how to form those. I can also share. I'll also put in the chat my development consultant. He's in New Jersey, matter of fact. So he works with people. He does different grant writing workshops and different things like that, how to start your business things. So it's just connecting with those type of individuals as well. And just gathering as much information as you possibly can, and to go forward with it. And don't let nobody tell you that you can't do it. Because I had a lot of people that told me, oh, you can't do that. Let me tell you, if it's a passion of yours, it belongs to you. It is your journey to start association. It was given to you for a reason. So move forward with it. You have a host of people here at the national level, and I'm sure somewhere, like she says, in Texas, because I also had the opportunity to speak with some of the associations in Texas that was not even a part of our database, and they're looking to form collaborations with other associations. So it's just making those right connections and to continue on your journey. Please don't stop, because it is much needed, okay? So you can always reach out to me and I'll make some connections and I'll help you do some research. Even though you're there in Texas, we got this technology where we can, get in there and to find the information that's needed for you to start that association, okay? Thank you.
Thank you for that wonderful offer. And Steph was already chatting back. Thanks, Ms. D, with a big smile. Nashua, we coordinate town hall meetings for our CHW networks. Every couple of weeks, you can connect with me. I put my email in the chat if that's something that you are interested in. Lisette, would you add to that conversation about thinking about starting a network or association? What else is important?
To take an organization to incubate you. I think that the tendency that there are two possibilities. You start with as a 501c3 separate organization, or you could be have a fiscal sponsor that does a lot of the work, but a lot of the background work, but that allows you to not have to worry about legal issues and financial issues that are part of having your own organization. So because funding will be scarce, I think that the one way to maximize it is by finding a fiscal sponsor that is philosophically aligned with the workforce and the vision for the workforce.
Thank you, Lisette. We have literally 1 minute. I know that everyone has received fantastic information, but I'm going to do quick, like 15 seconds for each person. If you wanted to communicate right now, one reason why CHW networks, coalitions, and associations are critical to lead, to coordinate, to inform our COVID-19 public health response efforts. Lisette, what would be that reason?
We have the pulse of the workforce, and we can connect with thousands immediately. So don't try to do it without the infrastructure that exists.
Thank you. Brenda Lee, what would you say?
To continue the networking and offering also your help, just like Ms. D did today. You think that you don't know, but you really have a base of experience to share, and keep on with the wonderful work you do.
Thank you so much. And Ms. D?
I'm gonna close it with this. We will get through this by seeing every challenge as an opportunity to better serve others. It starts with accepting the world is bigger than what's right in front of us.
Wow, thank you so
Ms.
much.
D, you rock! I love you, Ms. D!
Yes, woo-woo!
Wow.
We are together.
These will all be tweeted out, and all this will be carrying through. And I think you should share access to your self-care, because I think a lot of folks will join, or maybe we need to do a couple national ones.
Yes.
Just so we can get a taste of what it's like and build that capacity with our networks and associations. We will have other opportunities like this to hear from our coalitions, our networks, and our associations across the country. But I'm so grateful that Ms. D and Brenda Lee and Lisette partnered with me, that I got great support from Bernadine to make this happen, and that folks came out to recognize how CHW networks are responding to COVID-19. My prayers are with you and your family and your community during this time. We will get through this. We are getting through it, but let's get through it well. right? By reaching out to one another, by building on our assets, by recognizing opportunity, by being gentle and loving with one another. So great to have you all today, and be safe. Thank you again to our presenters and for this wonderful occasion.
Thank you, Denise. Thank you, everybody.
Thank you, everybody.